Hello, my name is Amy Lum. Today I will be performing an IV insertion and then discontinuing an IV. I don't have my school badge yet, it has not arrived, but today I have orders to give this patient an IV. I'm going to confirm that this is the correct patient. When I enter the room, I'm going to have the patient confirm state their first and last name and birthday for me. After I've confirmed that this is the correct patient, based on this young lady's body size, I felt that it was appropriate to use a 20 gauge needle for this patient. So I have all my equipment gathered on the side already. I'm going to wash my hands, put on my clean gloves, and then after I've put on my clean gloves, I'm going to take the flush and the IV tubing, and I'm going to prime the line. I'm going to prime the line to make sure that there's no air bubbles. Okay, no air bubbles. After this, I'm going to take my tourniquet. I'm going to tie my tourniquet 4 to 6 inches. I'm going to imagine this is 4 to 6 inches above the patient's arm. Okay. And then from here, I'm going to check for pulse. Okay, pulse is present. That also lets me know that I didn't tie the tourniquet too tight. Then I'm going to take my alcohol wipe. I'm going to clean off the area. Let it dry for a second. Undo this. Make sure that the bevel of the needle is up. Take my thumb, anchor the vein, and then insert the needle. As I'm inserting the needle, I'm looking for flashback, and once I have seen flashback, I'm gonna go in about 1/4 of an inch further and then thread the plastic catheter through and take with my index finger, put that there, take this out, discard this, and then undo the tourniquet. And I'm going to take the IV tubing and connect it. Okay, now that I've connected, I'm going to pull back a little bit to see if there's any blood return. That also lets me know that I am in the IV site. Then I'm going to flush, and as I'm flushing, I'm going to be observing the site to make sure that it is there's no swelling, there's no blood coming back, the patient is tolerating it well. And then I will take this over to the side, and then with my, I'm going to place the IV tape over to the side. Okay. And take this off. Okay. And then I will take another piece of tape, and I'm going to date and initial and time stamp it and put it there so that everyone can know when this IV was started. And I will take off my gloves and then toss that away, and I'm done with that. Now this patient has orders to get this IV discontinued. I'm going to verify that this is the correct patient by asking them to state